वेलकम टू इन्फोक्यूलर। आज हम एक एनाटॉमी की ब्रीफ कॉन्सेप्ट से डील करेंगे विच इज कॉल्ड एज एम्ब्रियोलॉजी ऑफ टंग. It is a small topic but substantially relevant for NEET PG exams. So let's get started. What is the origin of tongue? Tongue एक muscular organ है. So the origin is from myoblast. Myoblast is the precursor of myocyte. A myocyte undergoes myogenesis and then forms these tubular cells called as myocytes. So myoblast of occipital somites. What do you understand out of somites? Somites means segmentation, as in this food item में segmentation होते हैं. Similarly, हमारे body में embryologically there are multiple segments and each are independently responsible for development of a particular part. इसको हम somites कहते हैं. So myoblast of occipital somites are responsible for embryology or the genesis of tongue. This takes place from 4th week onwards in intrauterine life and can go up to 8 weeks. Next thing is anatomy of tongue. If you look at this diagram, you can see that there is an anterior portion of the tongue, anterior 2/3, and a posterior 2/3 of a tongue, along with a posterior most part. So there are three portions that we need to discuss: the anterior 2/3, posterior 1/3, and posterior most. इसको divide कौन कर रहा है? Now there is a specific V-shaped groove here with the apex which is facing backwards and the concavity facing frontwards. And this sulcus is called as sulcus terminalis. ये anterior 2/3 that is oral or horizontal part को divide करती है from posterior 1/3 which is the pharyngeal or the vertical part. And why is this division important? Because individually both anterior, posterior 1/3 and posterior most part are different, have different embryological origins. Hence it is important. Let us now assimilate about the foramen cecum and the thyroglossal duct. Foramen cecum is formed in the frontal crest of the frontal bone which ends in a notch. And this notch is articulated with ethmoid. ये superior sagittal sinus को nose से communicate करती है. And why is it relevant? Because this can form the passage of infections in this direction and hence forms the danger triangle of the face. दूसरी relevance ये है कि foramen cecum lies right behind a structure called as the tuberculum impar, which we'll come to in the next slide. और इसके पीछे यहाँ से there is the origination of thyroglossal duct. What is a thyroglossal duct? It is the connection between the original position, which is the oropharynx, to the final position of thyroid, which is the anterior aspect of neck. And normally it atrophies before birth. But in case it persists, it forms a mild bulge in the anterior aspect of the neck, and this is called as the thyroglossal cyst. अब टंग से क्वेश्चंस क्या आते हैं? So the question type is which pharyngeal arch does it arise from? Yeah, what structure? Apart from this, they will also ask you on nerve supply. This is the field of questions in tongue. So if you look at the diagram, there are 4 pharyngeal arches that have been drawn. These pharyngeal arches give rise to mesodermal structures. Similarly, जो depression है, which is on the external side, is called as pharyngeal clefts. And they give rise to ectodermal structures. The depressions on the inner aspect are called as pouches, and pharyngeal pouches give rise to endodermal structures. अब ये एक जनरल नॉलेज के लिए मैंने आपको बताया है, but embryology of tongue में इसकी relevance क्या है? Pharyngeal arch, as you can see, consists of 2 lateral swellings, that is lateral lingual swellings, and 1 median swelling, which is known as the tuberculum impar. These 2 combine together to form the anterior 2/3 of the tongue. So the 2 lingual swellings and the median tuberculum impar, which also means unpaired swelling, forms the anterior 2/3 of the tongue. Similarly, this structure is known as hypobranchial eminence. Hypobranchial eminence again is divided into two parts. One is the cranial part and the other is the caudal part. The cranial part gives rise to the posterior 1/3 of the tongue, whereas the caudal part, which is in the area of fourth branchial arch, gives rise to the posterior most area of the tongue. The nerve supply of tongue. इसके तीन components हैं, motor, sensory and taste sensation. Now the entire musculature of tongue is innervated by hypoglossal nerve. The only muscle that is not innervated by hypoglossal nerve is the palatoglossus muscle, which is innervated by the cranial root of accessory nerve. इसके अलावा सारे के सारे hypoglossal nerve से सप्लाई होते हैं. सेंसरी और टेस्ट सेंसेशन की एक फ्लो चार्ट या टैबुलर फॉर्म में या डायग्राम फॉर्म से आप याद कर सकते हो. The anterior 2/3 is the tricky part. The anterior 2/3 of the tongue has a separate nerve innervating for taste sensation, which is cauda tympani, which is a branch of facial nerve, and the sensory is innervated by a lingual nerve. जो posterior 1/3 है has a single glossopharyngeal nerve for both taste and the sensory function. Similarly, the posterior most portion of the tongue has only superior laryngeal nerve for taste and sensory function. So that is about it for tongue. Hope you like it. Happy reading.